In the dead of night, a child stumbles. The stars are out, the moon is bright, yet their eyes see nothing. The darkness is not in the sky, it is inside their body. Every year, 500,000 children lose the ability to see, not because of injury, not because of disease, but because of something far more invisible. A missing molecule, tiny, fragile, yet powerful enough to determine sight or blindness, health or death. For centuries, no one knew it existed. Today, we know its name. Vitamin A, the molecule that turns light into vision, fuels the immune system, shapes our genes, and, at high doses, can even kill. This is the paradox of vitamin A. Let's define this molecule. Vitamin A exists as preformed retinoids in animal foods, retinol, and retinol esters, and as carotenoids in plants, especially beta-carotene. The liver acts as warehouse, converting, storing, and releasing as needed. Being fat-soluble, vitamin A requires dietary fat and bile acids for absorption. Conditions like cystic fibrosis, Crohn's disease, and pancreatic insufficiency block absorption, causing deficiency even where diets appear adequate. Inside tissues, retinol converts into retinol and retinoic acid. Retinol enables vision. Retinoic acid, though, binds to nuclear receptors, altering gene transcription. It is both a vitamin and a signaling molecule. This dual role, cofactor for sight and regulator of gene expression, makes vitamin A one of biology's most powerful tools. Let's have a closer look at vision and survival. In the retina, vitamin A binds opsin proteins to form rhodopsin. When photons strike, rhodopsin changes shape, sending an electrical signal to the brain. Without retinol, this visual cascade collapses. Deficiency starts with nyctalopia, night blindness. Left unchecked, xerophthalmia sets in, dry conjunctiva, BTOT spots, corneal ulceration, and finally, irreversible blindness. Globally, up to 500,000 children go blind from vitamin A deficiency every year. Half of them die within 12 months, not from blindness itself, but from infections they can no longer fight. What role does vitamin A play in immunity, growth, and gene control? Well, vitamin A arms the immune system. It maintains mucosal surfaces in the gut, lungs, and eyes, frontline barriers against microbes. Without it, measles, diarrhea, and pneumonia become lethal. Retinoic acid acts as a transcription factor, activating over 500 genes. These govern cell growth, differentiation, and immune signaling. It is nutrition at the level of the genome. In embryology, vitamin A orchestrates patterning of the heart, eyes, and limbs. Without it, congenital malformations emerge. In children, deficiency stunts growth. In adults, it impairs reproduction. In both, it reduces resilience to disease. Did you know that the World Health Organization calls vitamin A deficiency one of the most preventable causes of childhood death? 250 million children are at risk globally. Staple foods like rice or maize lack vitamin A. Where diets depend on these alone, deficiency is inevitable without animal foods or supplements. Supplementation campaigns, just 2 capsules a year, cut child mortality by nearly a quarter. A single dose can restore sight and immunity. Golden rice, engineered to produce beta-carotene, promises biofortification. Critics debate GMO ethics, but for many children, it could mean survival. This is nutrition's paradox: excess calories but hidden hunger. Deficiency devastates even in a world of abundance. But what happens when there's too much vitamin A? Yes, vitamin A is life-saving, but dangerous in excess. The therapeutic window is narrow. Hypervitaminosis A causes nausea, liver damage, intracranial pressure, and bone demineralization. Chronic toxicity mimics brain tumors, headaches, blurred vision, even coma. Explorers once died after consuming polar bear liver, an organ so rich in vitamin A that just grams caused fatal poisoning. In pregnancy, excess vitamin A is teratogenic, linked to cleft palate, cardiac defects, and miscarriage. Prenatal vitamins now limit vitamin A content for safety. So which foods contain vitamin A, you ask? Animal liver, oily fish, dairy, and eggs are dense sources of retinol. Carrots, spinach, kale, and mangoes supply carotenoids, converted with efficiency varying by genetics and gut health. Half a cup of carrots meets daily needs. A single serving of beef liver provides 10 times more. Powerful, but potentially toxic if eaten regularly. Absorption depends on fat. Salad without oil passes carotenoids untouched. With olive oil, absorption triples. Diversity matters. A spectrum of foods prevents both deficiency and toxicity. Supplements are safety nets, not substitutes for balanced diets. In modern medicine, retinoids transformed dermatology. Tretinoin, adapalene, and tazarotene unclog pores, treat acne, and stimulate collagen renewal. Topical retinoids are the gold standard in anti-aging. They boost dermal collagen, smooth wrinkles, and reverse sun damage, results proven in decades of trials. Isotretinoin for severe acne is life-changing but tightly regulated. Monthly labs monitor liver and lipids, and strict pregnancy prevention is mandatory due to teratogenicity. In oncology, all-trans retinoic acid, ATRA, revolutionized treatment of acute promyelocytic leukemia. Once fatal, it now boasts cure rates over 90% with differentiation therapy. This is vitamin A as medicine. Topical, systemic, curative, cosmetic. Vitamin A taught us how one molecule can unlock sight, defend immunity, sculpt growth, or destroy life when misused. It's not a vitamin you take casually. It's the double-edged script of biology. In essence, deficiency is darkness, toxicity is fire. The line between life and harm is razor thin. Respect the balance. Never assume more is better. Let this closing question linger. If one missing molecule can cast you into darkness, what happens when 2, 3, or more are missing? The next episode begins the true unraveling. Thank you for watching this chapter of Medical Minute. If this peek into vitamin A changed how you see nutrition, give it a like, subscribe, and ring the bell. Not because you want more, but because your body needs more knowledge.